Good morning, everyone, and welcome to the March Health Innovation Team meeting. As many of you know, we've been doing this for around 13 years, meeting almost on a monthly basis over that time. And foundational to what we do is as we gather around topics and opportunities in digital health, we really look at digital health as literally being everything digital in health. And so that includes electronic health records, mobile apps, wearables, imaging, um, CRM sorts of things, really everything across the board, including SDOH systems. So one of the areas that we've kind of fallen down a little bit, honestly, is in the wearables area. And also having such a prominent player right here in our community with Garmin, it's sort of embarrassing to me that I haven't made that connection previously for us to learn more about all the goodness that is Garmin. And so that will be part of our discussion this morning, as well as a new offering in rural health as we're starting to look at the rural health transformation program. So that's what we're up to today, but let's start out with some introductions around the table and kind of let our presenters know who's here. But I'll start with our first presenter, Scott, if you want to just say hello and introduce yourself.
Yeah, good morning, everyone. I'm Scott Burgett. I'm the Senior Director of Garmin Health Engineering. I've been at Garmin for over 27 years. I've been doing the digital health, digital therapeutic, biosensor, wearable things since 2015. And I'm pleased to be here and tell you more about what we're doing at Garmin in this space.
That's great. Thank you. John Birch.
Okay, just got back. My name is John Birch. I'm here as a representative of a nonprofit group called the Health Record Banking Alliance, which is a national group that advocates and lobbies for longitudinal personal health records. I'll just leave it at that. It's an old idea whose time is finally, we believe, coming.
All right. Thank you, John. Sherry. Sherry Tawhid, are you with us?
Greetings,
Hi.
Sherry Tahid. Hello, everybody. Hello, John. I'm with the Ivanhoe Neighborhood Council. I'm a community health worker.
Great. Thank you. Bruce.
Good morning, everybody. I'm Bruce Bagley. I'm a family physician, and I'm on the board of the Kansas City Health Collaborative.
Great. Joe Bush.
Yeah, good morning, everybody. Joe Bush. I'm the Chief Strategy Officer for NavMD. We're a healthcare analytics firm based here in Kansas City.
Great. Jim Starsip.
Jim Starsip with KC Digital Drive. I lead our innovation and entrepreneurship.
Great. Laura.
Hi, good morning. Laura McCrary. I'm President and CEO of Kansa Health. We are a statewide health information exchange for Kansas and Missouri. We also serve 10 other states. We are a qualified health information network under TEFCA and hoping soon to be designated as a CMS aligned network. Thanks, John.
Great. Yes, I myself signed up with the CMS ecosystem as a friend of the ecosystem just after our HIMSS experience. So I hope to be very much a part of that as well. Cindy Fisher.
Hi, I'm Cindy with Smart Steps, and Smart Steps Mobile is a decision-making app. It's like a coach in your pocket, and it would be aligned more with the behavioral mental health space. So thanks for being here today.
Great. Stan.
I'm Stan. Good morning, everyone. I'm Stan Edlovich. I'm a semi-retired academic particularly interested in pharmacoepidemiology, and right now I've been playing around in the field of genomics, and obviously that is the wave of the future in terms of integration of large databases with genomic information.
Great. Cecilia.
Good morning, Cecilia Saffold, Health Teamworks.
Great. Great for you to be here. Thanks. Mike Douglas.
Good morning, everybody. Mike Douglas. I'm with Pomerol Partners. We're a data and analytics consulting firm, and I'm doing some work with Swope Health at the moment
Right. And you're based here in KC, right?
in Kansas City. Yeah.
Yeah, great. Um, Dan. Dan Crenshaw.
Good morning, everyone. Dan Cranshaw here. I'm the Executive Director of KC Health Collaborative. We are a member organization that seeks to advance health equity, and proud to be Count John Fitzpatrick and KC Digital as a member, and glad to be here.
Welcome. Thank you. Russell.
My name is Russell Ball. I'm the CEO of My Health Century. I have a product called Wearable Wars that helps health coaches use wearable data to extend their kind of enhance their coaching experience.
Yes, and we're looking forward to your presentation in the coming sessions. So thanks very much for being here.
Yes.
Julie. Julie, are you with us?
I am. I'm in the car. Sorry.
Okay.
Julie Dussel Culbertson. I am the Assistant Director at KU Med's new Data Coordination and Operations Center, currently funded by NIH's ECHO program, which is Environmental Influences on Childhood Health. We manage the Pediatric Clinical Trials Network that primarily serves rural and otherwise underserved pediatric populations. So excited to be here. Thanks.
Is that part of Don King's operation?
I do not believe so.
Oh, okay. Very good. Well,
what role might Dawn serve on that?
She has the large advanced AI lab at KUMC. And so we look forward to hearing from her in the future as well as your new work. So that's great. Thank you.
Okay. Yeah, we are housed in the biostatistics department, so there might be some overlap there, but
Okay.
I haven't heard about it yet.
Okay. Great. Well, thank you. Raquel.
Thanks.
Good morning. I'm also going to introduce my partner, Emily Ng, because we're both in transit, but happy to be here. My name is Raquel Garcia, and I'm the Executive Director of the new non-for-profit in Cass County, Heartland Wellness Connection. And we are, one of our big projects is to close the digital gap in Cass County. So that is just one area, but we are 3 months old as of now. So nice to meet all of you all.
Yeah. Well, it's really great to have involvement from Cass County because when KC Digital Drive was formed, we originally fell under the umbrella of the Mid-America Regional Council. So the whole 9 counties of the region were our original areas of responsibility. So it's really good to hear from Cass. Thank you.
Oh, you're welcome.
Dr. Waldron.
Hi, Steve Waldron, family physician, CMIO at the American Academy of Family Physicians. Our offices are based in Leawood, although we're a national organization for family docs throughout the U.S.
Thanks for being here. Malia.
Hi, all. Malia Grigsby here with KC Digital Drive. I am about 3 weeks into my position as the program coordinator.
Great. Lucia.
Good morning, everyone. My name is Lucia. I am a nurse. I am the Associate Director for Population Health, Health Equity for United Healthcare, one of the Medicaid payers in the state of Kansas. I'm also a student nurse practitioner for psych. So I have a lot of passions, I would say. It's great to see you all.
Great to have you. Thanks. Doug Hohulan.
Doug Hohulan with the Kansas City AI Club.
Great. Paul.
Paul Dow. Right now, I'm working as a adjunct professor for health informatics in a healthcare administration group. Also doing some reviewing for the Invest Midwest as a digital health app reviewer. Just a friend of technology and innovation here.
Great. Good to see you back. Dr. Moser.
Yeah, good morning. Dr. Mosier, I'm the medical director for the University of Kansas Health Systems Care Collaborative Association. We've been in existence really for 12 years, helping move evidence-based practice into rural systems, and we are assisting the state with the development and implementation of the Rural Health Transformation Plan.
Yes, thank you very much. I might note for the rest of us that Dr. Moser will be one of our panelists on Monday evening at Polsinelli starting at 5:30, where that winning team from of which he is a part for the award from CMS for the Rural Health Transformation Program. We will take that under discussion. We'll look at both the unique aspects of the Kansas application, but also understand a lot of the general aspects of the program. So we're looking forward to having all of you there. If you have the opportunity on KC Digital Drive's events page, there is a registration for that. It's free and the parking's free. We'd appreciate if you'd register in advance. So thanks for that. Scott.
Yep, Scott Schulpelmine, a partner with PwC in our healthcare M&A practice.
Great, thanks, Scott. Alexandria.
Hi, sorry. I'm a AI systems architect and a data product manager.
Great. Tyler.
Hey, good morning. Tyler Van Loo. I am a Snowflake healthcare advisor, partnering with health systems to leverage their data for analytics and AI-driven business insights.
Great, thanks. We have someone on the phone from 6099. Anybody claim that? Okay. So if I might ask, is there anybody that I've missed?
John Winhanson here from Sleep Fitter. We work with eye doctors connecting sleep health and ocular eye health.
Great. Welcome. Glad to have you here. And Samuel. Samuel, you want to say hello? Well, come back to Samuel. Anyways, I think we've covered everyone, and we're again, as always, grateful to have everyone together. We really have had opportunities to share a lot of great information and build on ideas, and so we really value what happens here, and glad to have everybody on board. With that, I'd like to go ahead and reintroduce Scott Burgett to speak to us about the role of Garmin in health. It's been some time. I'm familiar with projects going back a number of years, and but we really haven't given exposure to that in our own group here yet. So we're really eager to hear more and to kind of embrace having such a great player here in our community. So Scott, do you want to take us forward, please?
Yeah, thank you, John. So good morning, everyone. I'm Scott Burgett. I'm going to tell you about Garmin Health and how Garmin is investing using its wearable and biosensor technology in the digital health and digital therapeutic space. Now let's see if I can advance my slide. There we go. All right. You're probably familiar with Garmin. We were founded in 1989. We have a massive campus down at 151st and Ridgeview. We're a large company, but we're really leaning into our products are really focused on health and wellness and outdoor activities, aviation, and things like that. We are now over 22,000 associates worldwide with 90 offices worldwide. We're truly a global multinational company, 35 countries that we do business in, or that we have people in. We're fairly diversified. We have 5 segments that we do. fitness, outdoor, marine, aviation, and automotive. So you're probably familiar with Garmin Aviation. We make a system that will automatically land an airplane if a pilot becomes incapacitated. So very, very big footprint in aviation. We play all the way up to like Gulfstream type jets. We're not quite into like air transport 737 kinds of jets, but we're moving there. We sell a lot of in-dash systems like BMW, big marine footprint, but primarily where I work is in the wearable space, and the wearable space is contained in the fitness and the outdoor segments. We're really leaning into innovation, but our brand is very important to us. We really want to be rewarded by customer loyalty by making products that they really want to use. This slide is a little old. In 2025, we sold over 20 million products. We do introduce about 100 new products a year across the 5 business segments. That's a lot of products. I work in engineering, and I can tell you that that's very, very challenging for us to keep up with that cadence. So one thing about Garmin is we started out in 1989, and we were a GPS company. And this is back when GPS was really revolutionary and pretty unique. There weren't a lot of companies that could actually do it. And our first GPS products went into airplanes. They were in marine. But in 2003, we started developing sports watches. So we really started doing wearable technology back in 2003, and they were sports watches. I worked on those watches. In 2012, we started making them look a little more like watches, and they became specific to different segments of the market. Forerunner watches or Phoenix watches for outdoor adventuring, things like that. In 2014, we entered the health and wellness business market. So we started selling products into things like corporate wellness opportunities. So we were adapting our products for those sorts of opportunities. And back then the wearable market really took off with the advent of step trackers and things like that. We leaned into that. And now in 2026, we have a full portfolio of all sorts of health and wellness devices. We have wearables, we have chest straps, we have a smart scale, we have a blood pressure monitor, we have all these sorts of things that we are in our ecosystem that we sell into the digital health and wellness space. So we like to say that innovation is in our DNA, and I think that's certainly true. We have survived as long as we have because we've been very innovative, but I think it's actually more basic than that. I think that Garmin products are so great, it's because we use what we make, which means that if they don't work well, we take it personally. We want it to work the best in the business. So pilots, boaters, car enthusiasts, we all work here at Garmin, and the products that we make them so that they work well for us and our customer. I can tell you that the Forerunner came about simply because, and I was working in engineering back then, I came about simply because a lot of us engineers are runners. And we ran at lunch, we ran in the morning, and we were wondering if we could use GPS to track a run. And that's really kind of how it worked. So this is another thing I think that's really special about Garmin is innovation can take really circuitous paths. In 2001, we were working on this device called the Street Pilot 3, and it was one of the first portable navigation devices that would take you turn to turn, address, door to door with turn-by-turn guidance. And I worked on that. That was really cool. But in 2002, we developed this little GPS handheld called the eTrex, and it was really small. And we were really interested to see if it would work while you were running. And it was small enough that you could actually duct tape it to your wrist. And this is a later dramatization of that, but that's exactly what we did. We took eTrex devices, we strapped them to our wrists, and we went running. And from there was born the Forerunner. And then that was really where the modern wearable from the Garmin perspective was born. And now we've been doing it for a couple of decades, and now we have these really cool, fashionable, super functional watches like this is a Phoenix here. So sometimes, innovation, you just keep innovating, you keep moving into adjacent spaces, you keep applying your technology in different ways, and you never know where you're going to get. When I started working at Garmin in 1998, I was a GPS person. I never dreamt I would ever work for a company that made watches. I'd have never believed it, but here we are. So let me tell you some more about Garmin Health here. So what Garmin Health is it's a channel that we serve B2B customers and B2B2C customers. And what we're doing is we're taking our devices and we're offering value-added services and connectivity technology to allow people to do great things with them. So we will develop business models with partners to figure out how can you use a Garmin wearable in your application to do something great. And digital therapeutic, digital health, digital therapies, insurance applications, remote patient monitoring, readiness, worker safety, all sorts of applications can take our device and our connectivity solutions and make a bigger solution. So this is really important, is that we're an ecosystem player. This has always been our business model. We do not go out there and provide prescriptive solutions to people. We provide the wearable, the data, the connectivity to get the data to the right place. And we play in an ecosystem so that we can work with everybody. And so our devices are typically part of a larger solution. One thing that's really powerful about our solution is that our devices are phone agnostic, in that we work with Apple iOS and we work with Android phones. This is sort of how we segment our markets in the verticals. And this is not a super precise, but it gets us pretty close. We have healthcare vertical, research and clinical trials. I'm going to talk some more about that. Wearables and research is exploding. Insurance, we do a lot of business with insurance companies. Gym and fitness is, of course, sort of our DNA. Our forerunners are pretty much the standard for folks who are runners. Employee health benefits is a very important business for us, where we work with companies who want to do something for their employees to make them healthier. And that might be a subsidized purchase of a Garmin watch, and people will start using the watch and start getting more in tune with their health. And then we have another bucket called innovations, and all sorts of interesting things go in there. Worker safety is in there. Our military business, in terms of we have a lot of opportunities for like warfighter readiness, sensing people's putting a watch on somebody and then figuring out how well they're sleeping, how well they're recharging, and how well they are to do their job. So again, I want to emphasize that we're an ecosystem player. Okay, we kind of see the stack up at the base: the client, the patient, the user, and then on top of that, there are health and wellness apps, platform integrators. Some people integrate data. Health service providers may want to get this data. And then this is just a list of a lot of the companies that we work with who build these sorts of apps or platforms. And then at the top, downstream, the corporate employers or the fitness brands, insurance companies, healthcare stakeholders, they engage at this higher level. Sometimes they engage directly with us. Sometimes they engage with this level here. But where we fit is we're really plugging in down here at the user level, the subject level, or at the app integrator level, provider level. So for us, we feel it's about the data, the devices, and the connectivity. And we feel like we have really great technology in all three of these areas. We really spend a lot of effort to make sure that our biosensor data is high quality. We invest a ton to make sure that it's all as modern as possible, as accurate as possible. Then we have devices. I don't know if anyone's ever gone to our website to buy a wearable. It's bewildering. We have so many devices. We have a device for everybody, whether or not it's a low cost device or a higher cost device. Whatever you're after, we make. And then the thing that Garmin Health does in particular is provide connectivity solutions. So typically our relationship is someone buys a device and then they use our tools, Garmin Connect Mobile, our app, and they look at their data and their runs and they do their thing. There's extra connectivity required in order to move that data from the user to a third party. So the connectivity solutions we have several I'll talk about, but here's the deal is like the data is the user's data. That is our business model. And so if there is a user that wants to share data with a particular app because they want to learn how to be a better sleeper or deal with anxiety or manage their chronic condition, they have to give Garmin explicit consent to say, please share my data with this app. And if we get that consent, we'll do that. So that's an important part of how we do business. So wearable technology is developing really rapidly. It's still developing quite rapidly. This is just something in 1972, for those who are into the science of actigraphy, which is like how much you're moving, this was one of the first actigraphy watches. It was a little accelerometer module you wore on your wrist, and there was a sensing module you wore at your belt. It was very clunky, very, very hard to use. Now you just wear a watch and you get all sorts of things. You get heart rate and beat to beat interval and heart rate variability and respiration and pulse ox, actigraphy, sleep. It has GPS, so you can measure your run or your bike. It has all sorts of things. It's amazing how far it's come. This is just sort of, again, I'm talking about the data, but we kind of started out with just steps, right? And I remember back when this was happening, I was thinking steps, that's not very interesting. What are you going to do with steps? Well, it turns out that there was an enormous amount of science that was done on step and step trackers and activity levels. But it's continued to evolve. Sleep is now super important. We have a very in-depth sleep solution. If you wear our wearable at night and we can measure your sleep, we measure your calorie burn, intensity minutes, how much you're exercising. We measure your body comp. If you have our scale, we have raw acceleration and gyroscope data available if you integrate with the right solution. Heart rate, stress, body battery, pulse ox. We're doing more in women's health. Respiration, we can sense your respiration just by wearing a watch. Skin temperature. So all of these digital biomarkers or measurements are available for folks who want to use them for their particular application. Let's see. So we talked about the data. We know there's lots of devices out there: Forerunners, Phoenix, Vivo Active. But let's talk about our ecosystem. So basically, if you're interested in using a Garmin wearable in your application, to get the data from your subject, they have to consent to share their data, and then you can get it in a variety of ways. A real standard way that happens is our Health API, which is a cloud-to-cloud solution. So what that happens is that once this API connection is provided, when data is uploaded from the watch into a Garmin cloud, we'll send through the API, we'll send a ping and say, hey, their subject XYZ has data, come and get it. And you get pretty rich data set, but not all the data. It's not as granular, but this is part of the Garmin Connect Developer Program. And if you're approved, if you're an approved business partner, it's actually free of charge. A lot of people want more granular data than that. So they want like acceleration logging, or they want to log the beat to beat interval all the time. And so we produce an SDK. So if you're an app developer, you can use this SDK, develop an app, and you can talk directly to the watch and you can get some high frequency granular data from the watch via data logging. Things like a 25 hertz acceleration or beat to beat interval all the time. If you're going to use an app, though, if you're going to use our SDK, it's a license fee or a minimum device order. So that costs money because that's a much higher level of support. We have a much higher spend on our side to keep that up. Then finally, we have this thing called the standard SDK, which again, you write an app, you talk directly to the watch, and all the data comes directly to your app, and it bypasses the Garmin cloud. And for folks who are worried about privacy or they're worried about security, the standard SDK will do that for you. So we have a lot of people that do this. The problem with this solution is that you lose the Garmin Connect mobile experience and the Garmin experience. So all of the great stuff that you get as a Garmin customer goes away because that data is all just shipped over to the app via the standard SDK. Just a cartoon about how it works. This is the API. It goes from the watch to the phone up to our cloud, and then via the health API, we will talk to the partner cloud and send the data across. The watch can store data for 4 weeks or more without a sync. So we have people who, in some military things, folks will go and they won't be able to sync to their phone for a month. That's no problem because when they come back in range of their phone, all that data will sync up. This sync comes up pretty promptly. It's at least twice a day, sometimes more. Through the API, you get all sorts of daily summaries about steps, heart rate, intensity minutes, floors climbed. You get sleep, you get stress, pulse ox, respiration, heart rate variability, skin temperature. And you can also get some beat-to-beat interval over the API, but it's a premium feature that requires a separate contract and more money. And then this is how the companion SDK comes in. You see there's a BLE link between the partner app and the phone, and granular data goes across there. And just recently, we now have a Wi-Fi syncing solution. So for folks who have a many to one they need a many one kind of hub solution, the watch will actually sync over Wi-Fi right to your partner cloud over a Wi-Fi access point if that's of interest to you. And then finally, the SDK, as I described it, there's no Garmin involved. All the data goes straight across to your app. And a lot of people actually use this. Okay, so that's how you work with us. You buy our products, you need to use one of our connectivity solutions, and then suddenly all this data opens up to you. So I talked a bit about wearables and research studies. So wearables are now becoming very, very common in research studies because a Garmin wearable in particular has very good battery life. You can wear it for 24/7 for like 7 days before you even have to charge it. It's objective data. It's not subjective questionnaire-based thing. It's just blowing up. And as you can see, the number of publications where wearable technology is involved is exploding right now. And Garmin itself has some pretty significant engagements with research universities who are using our wearables at scale to do big longitudinal studies. We're working with National University of Singapore in their Project Reset. That's a 5-year longitudinal study. They're using vívosmart 5. We have a collaboration with King's College London. This is just one of the things that's underway. VivoActive 6. It's called the Embrace Study, and it's about to improve maternal health and outcomes globally. Big population health study. And then in the University of Copenhagen, 9,000 people, they're looking at the treatment of obesity through personalized medicine. So again, another big population health kind of longitudinal study. They're using Garmin devices. Okay, just a few example integrations here. And I'm going kind of fast. I want to leave time for questions, of course, but this is something that's super neat. So it's Orbit. They have a Parkinson's solution called Neptune, and it's totally enabled by Garmin sensor technologies because what they're doing is they're sensing Parkinson's tremors, and they do that by actually accessing the accel and gyro that are native on the device. And we're one of the few people who actually allows access to that granular data from an inertial sensor like that. So they look at accel and they look at gyro, and they're looking for the tremor, and they try to figure out when they need to adjust their medicine. So I'm not an expert on this, but they identify when the medicine is wearing off and when they need to adjust the medicine. It's pretty revolutionary for the Parkinson's community, and we're really proud of that. They worked for quite a long time with us on this, and it's an ecosystem play. Like, Garmin isn't going to do anything with Parkinson's, right? That's not our business. We make wearables, but it was great to be part of this ecosystem and enable this sort of great application. This is another one that's super huge. It's another population health kind of thing. I don't know if you've heard of a company called Twin Health, but digital twins are pretty common now, and they're kind of being talked about a lot. This company makes a digital twin with the idea to digitally represent your body and your metabolism and give you precise guidance to manage diabetes. And so the data from the Garmin wearable about sleep, activity, and breathing and all this sort of stuff is super important to drive their digital twin technology. And they're having remarkable success. So this is from their publication. 84% of the group who followed their digital twins guidance for 6 months were determined to be in remission by the end of that period per the ADA standard. So they're having extreme success with their therapy, this digital therapy for metabolic disease, for diabetes. And then, since this is local, I want to talk. We are doing work with KUNC. We are work quite closely with the Digital Health Co-Lab there. And we're sponsoring with the CoLab and KUNC 2 awards. It's called the Wearable Insights into Health. We're funding 2 observational studies that utilize Garmin wearables with a specific focus on 2 areas: cardiovascular disease and hypertension and mental health. There's a competitive award process. 2 proposals will be selected, 1 in each focus area. The proposals are in. We're actually in the judging phase of this, but we're super excited. We Garmin and KU are trying to do more things together to align with KU's mission in terms of rural health, things like that. So this is real exciting, and it's been really great to work with the KU folks. So that is it. I went through that pretty quick. I gave a lot of information, but like I said, I didn't want to take too much time, and I wanted to have time for questions and all. So I'm done, John. I'm ready to turn it back over.
Oh, that's great, Scott. Thank you very much. You did very well with that, so don't worry. I also am familiar with some projects that Garmin has done with Children's Mercy as well. Some of this goes back to the Our Healthy Kansas City East Side and the Our Healthy Jackson County projects. And they were using one of the Vivo products to engage community members in activity, and then monitoring that activity and weight and blood pressure outcomes as a result of the activity. And they had really outstanding outcomes from that. And also, one of the remarkable things is that sometimes when wearable devices have been given, even in a healthcare setting, to like the staff of a hospital, they would have a drop-off rate of over 50% within the first 3 months. Children's Mercy did not experience that with this community initiative. I think the retention rate was over 85%. So, it's just remarkable things that have been happening with Garmin wearables. And as I said, we're so excited and pleased to see the activity even here in our own community. So really appreciate that. Let me open it up to questions from others, please.
Yeah, I have a question. Scott, great
Hi.
presentation. One thing been following is over medication, and balance and low blood pressure. And so I was wondering, how has, again, you work with these companies, but, have you looked at that area, the rate of falling, like especially people 85 and older has gone up by 2.5 times. People die from falling by population. So, there's been studies that if they cut their medication down, your risk of death goes down dramatically. So I was wondering, using how do you balance, how is your balance? And then if you add medications, is your balance getting worse or better? Any thoughts on, wearables around that? And then also the holy grail of blood pressure and blood sugar, and where do you think those technologies are going to be available?
Right. Thanks for that. Fall detection is a super hard problem because I would say that a hard fall where you trip and you just eat it, that's pretty easy to detect. But elderly people, infirm people don't fall that way. And so the challenge with fall detection is to have high sensitivity but not have a lot of false alarms, right? So it's a
Right.
classic false alarm problem, right? It's like, how do I have sensitivity and not have a lot of false alarms? Wearables have a role to play here because we actually have the right sensors to make that happen. We have Excel and we have gyro, and so I think there's opportunity here. I know there are companies that we work with who access our Excel and gyro data, and they're trying to do this sort of thing. So I think wearables, in terms of like just monitoring, keeping people aging in their house and being able to monitor them, there's a huge application here, and those inertial sensors are part of it. So yeah, I would say that it's an active problem being worked. I think you're going to see more good things coming, but like I said, what you can't do is you can't have a false alarm a day or two false alarms a day, or else people are going to turn it off. So you got to be careful there. Um, in terms of the holy grail with glucose, I think true non-invasive glucose, through a wearable, I think that's probably still 10 years away. I think we're probably a couple technology steps at least. Maybe the actual technology that will pull that off hasn't been invented yet, but it's certainly something to keep in mind. I think that the CGMs from Abbott and Dexcom are amazing devices, and so there are ways to do it now. But someday I would certainly like to be able to just put on a watch and suddenly we can tell you your glucose, but we're not there yet. And there's a lot of noise out there. I've looked at this problem really carefully. Don't believe all the hype. It's coming, but it's going to take a while.
Thank you.
Okay.
Scott,
Hey, John, I'll
Hanson.
jump.
Okay,
Oh,
go
go
ahead.
ahead, Win.
Yeah, go ahead, please.
Well, I just Scott Hanson. I'm really bullish about sleep. You mentioned it 5 or 6 times within here. Dr. Gottlieb and Sleep.ai are guys that I know, and they recently came out with some studies that showed that 85% of people won't wear wearables to bed. And then they did a side-by-side study of 9 different products that discovered that every product, none of them tracked the same. They gave different results, and none of them were consistent across sleep. Where do you see Garmin going with sleep, knowing that wearables are not something that wants to be on the body? Are you considering sensors and integration with products other than wearables?
We certainly recognize the importance of sleep, and we are going to continue to invest and make sure that our sleep offering is good and as accurate as we can make it and as comprehensive as we can make it. Um, uh, in terms of like the accuracy, so I've worked on Garmin Sleep from the very beginning. Um, I shouldn't say this, but I call sleep science the dismal science because it's so hard to get two sleep labs to get. Sorry, some people like that. you can take two sleep labs and two sleep technicians and score the same thing, and you can get 80% agreement. I've seen that in the literature. So someone takes a wearable device and they said, yeah, this is 70% accurate. It's terrible. And it's like, yeah, you're scoring against 80%. So it's actually not as bad as you think it is. I think we can get better, Scott. I really do, and I want to get better. But I do think that just having understanding and awareness of sleep and sleep hygiene has been a huge advantage and a huge benefit to society, that people are now aware of how important sleep is, and the wearable does give them pretty good information about that. Maybe not polysomnograph quality, but really good information. And so I think there's been a lot of benefit, but there's more work to do for sure.
Yeah. Hey, Scott, Dick Flanagan here. First off, wonderful update. I always enjoy hearing about really the Garmin ecosystem and how your long experience there really has powered the growth of this healthcare vertical for wearables. So thanks for all you're doing. Thanks for the work with KU.
You're welcome.
I think that we really wanted to see Garmin engage in our local community. We still have a vision at Digital Health KC that we want to become the wearable capital of the world, because we do have the world's best wearable manufacturer. And we want to continue to encourage early stage companies and companies, frankly, at every stage to incorporate wearables. So that's still in our objective for how we want to see the ecosystem grow. But I'll give a little endorsement on the Garmin. When we were getting to know Scott and Andy, I went out and got a Venue 3, and I think it's fantastic. I think the amount of information that you provide, I completely agree with what you said on sleep. It's not whether it accurately got, whether it had 7 hours and 26 minutes or 8 hours and 5 or 6 hours. It basically gets it right on the general duration and the quality of the sleep. But more importantly, every morning I wake up and go, yeah, I had a crappy night last night. I get it, or I need more. So I think you hit the nail on the head. It's awareness to a great degree. And I think that's people that wear these, even if they haven't connected to an app, it's kind of that little guy nagging at you, kind of like, hey, yeah, have you thought about this? You haven't moved much today. So I think Garmin's on the right path. I love the ecosystem play, and I'd encourage those listening to think about how you can incorporate a wearable, particularly partnering up with Garmin and their rich APIs and rich ecosystem, to think about how Garmin can be incorporated into your offering. So that's a little Garmin commercial, but we're delighted with Scott's work and Garmin in general. We think it's one of the jewels of the Kansas City ecosystem.
Thank you, Dick.
Yeah, absolutely. John Birch, you have your hand raised.
Right. Yeah. Scott, a couple questions, particularly about the data sharing, I guess, and I guess I'm especially interested in data sharing for research purposes. Except that, well, those are the two questions. Who owns the data, and when it's collected? I mean, like right away, and where is it, and what sort of record do you have of the context in which it was generated? Was someone on a bicycle ride? Were they running? Were they just walking? Et cetera. What sort of metadata comes with the data?
So we have an activity API which will supply all the details of the activity, what the activity type was, how far you rode or how far you ran, what the heart rate was, all speed and distance, all that sort of thing. So you can get all the activities, and you can get all the daily biosensor stuff. That's all there and available over the API. So if you're using the API, which is the cloud-to-cloud version, that data is the user's. The user, it's stored by Garmin for the user, and the user can access it whenever they want. The user can send us an email and tell us to delete it, and we will delete it. It is their data. However, they have agreed to share the data. They've actually got on the Garmin website and filled out a form that says, I, user, consent to share my data with so-and-so for this purpose. And when we have that record, then we will establish this API connection and then their data will go across. So when the data gets to the third party, then it's between the user and the third party. Like, what are they going to do? Like what's that data governance look like, sort of thing. But that's how we do it. It's between us and the user, and then it's between the user and whoever else there is. So people think like we have millions of users in Garmin Connect in our cloud. It's not accessible because we store the data. We have privacy policies. It's not like you can come to us and say, I want a million people's data. We won't do that, right? You have to go find all these people individually and make them explicitly consent to share their data with you. But so that's how it works.
So do you keep track of what is the actual physical provenance of the data? Does it go from your watch to your phone, and then from your phone to the cloud?
Yes, correct.
Okay, so it does pass through the phone, because that's becoming increasingly a sort of a pretty vulnerable kind of a spot for a lot of people. Okay, but that answers the question. And then when you send it to a third party, they have to request it, or do you automatically send it once you have the proper permissions?
Once this OAuth connection is formed, this encrypted connection is formed between our cloud and their cloud, when new data from the user arrives, we send them, it's called a ping. We send them a little message that says, user X has new data available on our cloud. And that's the end of it. If you come get it or you don't come get it, it's up to you, right? We don't push anything around. It's all pulled by the partner based off of, we notify them that new data is available. So it's called a ping pull methodology, what we use.
Ping pull, yeah. Okay. And then finally, when you get these data use directives, or that's what we call them, where they say so-and-so may use my data, so ping them and they'll give it to them when they want it. How do you identify that the person that you're pinging and then follows up on the ping is actually the entity that they really did mean to give permission for?
Well, I think we use encrypted keys. So the person on the other side cannot impersonate anybody because there's only one encrypted OAuth key available, right? And so we establish through an encrypted connection that the person on the other side is who they are. Now, if the person on the other side loses their keys, well, we can't, that's a problem, but it's actually done in an encrypted, highly secure manner, the way that data is transferred back and forth. And it's all encrypted during transit as well.
Great. Okay, thank you.
Hey, Scott, what are the two coolest projects that you've worked on, and where do you see the next three best opportunities for people like us?
Oh my gosh, what a great question. I've worked on lots of cool projects. I just find this cool because I'm kind of a nerd. We had some watches fly on the Polaris Dawn mission with SpaceX, and they were Phoenix watches. And the thing about Polaris Dawn is that they opened the hatch, and the crew cabin went to space vacuum. And so I'm talking to the SpaceX people, and they're like, "Hey, is it okay if we take your watches to vacuum?" And I'm like, I'll call you back. I don't know. So I called over to the manager of engineering and I said, what do you think will happen if we take a watch to a space vacuum? And he says, well, I'll get back to you. And he came back and he says, I think we're going to be fine. So these watches went up into orbit and they went to vacuum and they performed flawlessly. So I like that simply because we make cool tech and our tech is tough and it worked real well there. I think that's been a really cool one. I really like people who use like our sensor technology, for example. I mean, we have little silicon MEMS, gyros, and accels, right? That they're very common, but I think we're pretty unique in that we expose that data, and that allows people who are really smart and understand about inertial sensors to do some really cool things. And so I'm really proud of how that's enabled some things like this Parkinson's disease thing. Um, the big opportunities here, I think, are coming. And I notice there's a lot of kind of population health people on the phone. I think wearables in population health is still untapped. I think there's a lot that can be done with wearables and improving disease burden for like metabolic diseases, cardiovascular diseases. I think there's a lot of untapped potential there. I'm excited about that. And the other one that I think is oh, and it just flew away. The other one that I think is remote patient monitoring. And I say that in a big term, like we're still trying to tap into this, but in Asia, the oldest son takes care of the parents, right? And the oldest son may live 100 miles away. There's a huge appetite for allowing people to age in place and stay in their home and be monitored. And I think a wearable is an ideal way to do that if we can build the right infrastructure. But there's a lot that needs to be done, right? It's not just having a good wearable. There's way more than that. But I think that remote monitoring application is also going to be big someday, and there's a lot of opportunity there. That's just my opinion, though.
As a person who has taken care of multiple aging folks in my own family, having greater visibility into what is going on with them would have been huge, absolutely huge. So I really encourage that direction very much. Randy Logan, please join us here.
Yeah, thanks, John.
Mhm.
So I certainly agree that the patient monitoring health outcomes research is a huge sector for valuable wearable devices and generating data to advance that research. I'm sure your teams are looking into this, but when I look at what's going on in the clinical trial space, and I see a huge push for rural health, rural clinical trials access. Some of the barriers that exist are just the throughput of the staff and the ability to analyze data and generate the data. One of the opportunities here for Garmin, and I'm sure you guys are doing this already, is to look at clinical trials and divide it up into the different therapeutic areas and say, when we look at oncology, what are the biomarkers that are typically gathered for an oncology trial? Do our wearables gather the data that align with those biomarkers? Probably not, because they're very complex. But then as you move into other therapeutic areas like cardiometabolic, how many of those biomarkers are these wearable devices able to cover in those particular study protocols? And I could easily see where you could get on clinicaltrials.gov and use AI to deep mine what the biomarkers are for these different therapeutic areas, and then start to outline where Garmin can make a big play in specific therapeutic areas for decentralized clinical trials, and have Kansas City serve as kind of the launching pad for this with our deep integration of health outcomes research and clinical trials in especially cardio metabolic and that therapeutic area. But I just wanted to throw that out there and get your response on that, because it's a high interest in BioNexus and some of the work that we're working on right now.
Sorry to interrupt. Randy did not get a chance to introduce himself before we started. Randy, do you want to just say a word of your background, and then Scott, you can jump in.
Sure, I jumped in a little late. Sorry. I'm Randy Logan. I'm the scientific director for BioNexus KC. I work really closely with Dick and with Dennis Ridenauer.
Yeah. Yeah, nice to meet you. I think that's a great question, and I think that discovery is happening right now. There's sort of, in my mind, there's kind of a green field about digital biomarkers and what a wearable can sense and how it maps into different parts of disease processes. One thing that I think is very, very powerful is, and something that Garmin does very well, is measure the beat to beat interval, which is, how you figure out the heart rate variability. And there's a huge amount of science involved in this in terms of parasympathetic, sympathetic nervous system balance and things like that. But I believe that by monitoring beat to beat interval, you might find applications in lots of different, that biomarker might be useful in lots of different ways. And I think that the research to figure that out is happening right now. We're trying to do some of this research with KU right now, for example. I think everyone's really interested because we know the wearable can be deployed into a rural setting. It's like what can you glean from it, right? And how do I use that as a clinician or a caregiver trying to figure out how to deliver care at a distance like that? That's happening right now, and that discovery process is probably going to take another several years probably, but it's happening.
Great. Any other thoughts, folks? We've actually had a challenge. Something's come up for our second presenter, so we'll have to defer his presentation, so we can take a few more questions. Maybe one thing I'd like to do first, though, is just have a few folks introduce themselves who joined us late so that Scott kind of knows who has been around the tables. And I'd like to invite Tish Bryant first to say hello.
Hello, I am Tish Bryant. I'm the Community Integration Coordinator at the Missouri Primary Care Association.
Thank you. And Dennis, are you with us?
Yeah, thanks, John. Dennis Ridenauer, CEO at BioNexus KC. I'm wearing my Garmin watch now.
Good job.
Thanks, Scott. Great presentation too.
As we speak, right? Okay, Dr. Tyler.
Hey, Dr. Tyler, founder of Just Ask Evie. We do virtual clinical IT support for physicians and nurses.
All right. Is there anybody else that I've missed? Randy and Dick both got a chance to say hello, which is great. Any others? Jessica.
Guys, my name is Jessica Powell. I own Social Balances. We're a PR marketing connectivity activator here in Kansas City, and I have had really just so much pleasure learning about all the organizations that come together to support Kansas City, and there's so many wonderful players on this call. Glad to be here. We host a investor meetup on the first Tuesday of every month, and we get to bring a lot of the people on this call together to talk about where we're at in the early stage tech forum. And I appreciate being here, and I appreciate your guys' work.
Great. Thanks, Jessica. Before we let Scott go, are there any other questions or comments?
I wanted to say to Scott, I think this is great work that you're doing. And at Ivanhoe, we have a large group of seniors who could really benefit from this technology or even pilot something to support some of our community with regard to some of those disparity issues, such as diabetes, type 2. Getting that under control. So I will be reaching out. Thank you.
Sure. Thank you. That'd be great.
Okay.
Hey, John, I may jump in, and because Sherry brings up a good point. Scott, really good presentation. We're the project management organization for one of our local initiatives here, the Learning and Action Network, and we're focused now on designing a maternal health initiative to address the Black maternal health crisis. And hypertension is definitely related to that, and it's something we've been talking about. I've got a couple of board members on the screen as well. So we may be in contact because we are looking at ways to clinically, meaningfully intervene to address hypertension. What has become a big talking point are blood pressure cuffs, which not everybody knows how to use, and that there's a lot of education involved, but wearables could provide the same sort of data without the level of training required to do blood pressure cuff. And it's also, there's a degree of passivity to it. And I know I'm not supposed to multitask, but I jumped online because I've got my cheap Apple Watch, Dennis Ridenauer. And I see that your batteries can last for weeks at a time. So there's There's a level of remote monitoring that's possible as well. So we may be in contact just to have a conversation with you about what a pilot
Sure.
might look like, because I think
That'd be fun.
it could benefit a whole bunch of areas outside of health as well.
Jessica, did you have something else?
No.
Okay. That kind of raises a question. I think you described the ecosystem really well, Scott. Probably what I would concentrate on as we kind of sign off here is the practical or mechanistic side of things, and that is um, what is the best way to follow up? Garmin being so willing to work with partners and so on, what is the best practical way for people to follow up in that regard?
I think an email to me. We have a business development team, Andy Beckman, Jesse Blacksock. So if people were to email me, I could get it to the right people. We could respond because we have a group, people whose their job is to field inquiries like that
All right,
and respond.
great. And it looks like we have one more question. Samuel, would you introduce yourself first and then go ahead with your question, please?
Thanks, John. And good morning, everyone. My name is Samuel Swartfeld. I'm a Kansas City-based entrepreneur. Our venture looks at using virtual reality and simulations to provide nurse training. And so I'm very delighted by your presentation, Scott. My question is, without using the cloud, are there opportunities to do some of the health analysis or get some of the metrics on locally on the device itself? That's my first question. And then I'd love to learn more about applications around mental health in particular.
So without going through the cloud, you use the standard SDK. So it's a device to app transfer of the data. The data is available to you on the device until it's synced across to the app, and then it's deleted behind. We clean it up and delete it once it's gone across. So it is available, but it's only available until there's a synchronization process and the data is transferred over to the app. But you still can look at the watch, get all the good things that the watch tells you while you're using the standard SDK. And the second question was
Mental health. Mental health.
Oh, I think mental health is still greenfield for wearables because I think one big marker. I don't want to oversimplify anything, but just your activity level. Like, are you getting up? Are you getting out? That's easily measured by a wearable, and I think that's super important. Objective data for somebody to have in a mental health application. How well you're sleeping is also available. So I think the biomarkers that are available on the wearable, which are objective, could be really, really useful in mental health therapy or treatment or monitor or whatever you wanted to do. I think there's still lots of opportunities there, honestly.
Thank you. Thanks. So John, John Birch, you had another? Go ahead,
Yes,
please.
this is just brief. Scott, when we were talking about metadata before, you said that it somehow is possible to go along with the data to know what the context was in which it was generated, where you're bike riding, where you sitting on the couch, whatever. But I have another question for you, which is, does the data say that this data came from Garmin, from a Garmin device? In other words, people over time might have used a Fitbit device or something else, and they might have been saving that data. How do they distinguish the data that came from a Fitbit device from data that came from a Garmin device? Is it tagged in some way?
There's an attribution for that that's in the data as it goes across. So what device it came from is part of the metadata, for example. I think probably firmware version is probably in there as well. So it is
good.
There is attribution that way, and I agree. It's important to have that because there are other people that do this, right? And we want to know whose is whose.
Right. And especially since you were talking about all the data for sleep varies so much across devices, that's another particular medical kind of area where this would be particularly important. Thanks.
Yeah.
Okay. Scott had mentioned getting in touch with him directly, and I am putting his email in the chat for folks to be able to do that. And I think we're good. Samuel, I just want to check. I hope I did not cut you off too soon. Did you get what you needed?
I did. Thank you.
Okay, you're welcome. All right. Well, thank you all very much. We look forward to seeing many of you at the forum on the Rural Health Transformation Program on Monday night at Polsinelli. As I said, there's a link on our events page for registration, as well as on the Digital Health KC events page. So we invite you all to do that and look forward to seeing you there. There will be light refreshments. As I said, it also is free admission and free parking with validation. So please do register. And we'll welcome you again next month. We'll have our brief for that meeting out shortly, and look forward to continuing with you all. And thanks again very much, Scott.
You're welcome.
It's been so long since in before we've done this, so it was very welcome, and we certainly appreciate it.
Yeah, I really enjoyed the conversation as well and the questions. Great
Great.
stuff. Appreciate it.
Thanks, everyone. Bye now.
Bye.